Okay, so Bob, we recently had some very exemplary patients in terms of difficult case management. And thank you,
You can
thank
have the
you.
microphone.
Okay, so both of these ladies, female age 54 and female age 52, present to us with a very complex pharmaceutical profile. Patient age 54 female is on 3 different depression drugs, 2 sleeping drugs, Lunesta and Trazodone, 3 types of pain drugs and restless leg syndrome drugs, Percocet, gabapentin, and pramipexole. Then she has her constitutional drugs for hypertension. She's on furosemide, potassium, and lisinopril, lovastatin, and then her diabetic drugs, the metformin and insulin. Patient number 2, age 52, also on 3 depression drugs, 3 different pain meds, including gabapentin, methadone, and Motrin, sleeping drug, Ambien, and then her systemic drugs for thyroid and allergies. And when we see something like this, they're asking us to help them come off their medications. So, just some insight in terms of what is the approach? How do you prioritize which drugs, and how do you change that?
Okay. In our clinic, we usually do 4-month plans. The plans are divided into 3 segments, which are given simultaneously. Every patient's getting acupuncture. Most patients are getting Chinese herbal consultations, and then the patients are receiving nutrition and, in most cases, weight loss. All 3 of these things are coming at the patient at the same time. So what to do about all these drugs? The main thing is, of course, we're not licensed to tell them what to do with drugs. And so we have to, it has to be very clear to them, both in writing and verbally, that, we are not licensed to tell you what to do with your drugs. Your doctor is not us. However, the approach is the following. A lot of people are taking pain medications. These 2 women are specifically. So the key is to make them feel better through the acupuncture and the herbal treatments. When they're about 50% better, then what I do is I say, okay, these are the 3 drugs that you're taking for pain, the gabapentin, the Percocet, and the other one. And these are the ones I want you to call your doctor about. And now you can start the process of coming off these drugs, one at a time, according to the instructions from your doctor. Because they're also losing weight, generally our approach to hypertension is we don't even treat it other than they lose 30 pounds, and that usually takes care of the lisinopril or the angiotensin II blocker, Benicar, and certainly the beta blocker. Now, if the patient is taking a beta blocker straight up when they come, we highly recommend they go right back to their doctor and ask them to get off of that beta blocker, because beta blockers are not really used straight up anymore for hypertension. They're mostly used for post-surgical procedures for people who've had double bypass or stents, or they have AFib. But they're not used very much anymore for just mainline hypertension because there's so many side effects from atenolol, metoprolol, propranolol. They cause extreme tiredness, circulatory sluggishness, and the people gain weight. And oddly enough, these people always have a complaint of fatigue, and there it is. They're taking atenolol. So I always send the patients back right away to try to get them off the beta blocker. As for the pain meds, I wait till they're about 50% better, which usually takes a month, and then they start the process. And generally the doctors will strip away the gabapentin first. And if they tell the patient, oh, stop your gabapentin in 2 days, don't do that. That gabapentin, you have a strong, there's a very poor recovery from just stopping it immediately. So we always recommend taking about 2 to 3 weeks and to come down very slowly. If they're going to come off gabapentin or Neurontin, it's the same drug, then you want them under your care so that you can take care of them while they're going through the withdrawal. Mm-hmm. And the same for the opioids, Percocet and others. So that's the approach with the pain meds. Now, they lose 30 pounds, their pain is 70% better, they're not on the pain meds anymore. Obviously, they're probably not going to need the Lunesta and the Ambien to sleep. So the sleeping drugs will naturally fall away once the pain's a lot better and their weight's lost. So you the doctors are taking away the drugs because the patient's healthier. Mm-hmm. And but you have to focus on it. If you just treat the people willy-nilly for 4 months and you let them take all these drugs and make no suggestions in terms of going back to their doctor, you've done them a tremendous disservice, because now they went through your clinic, they feel better, but they're still strung out on drugs for the rest of their life. So it's astonishing how much pharmaceuticals Americans swallow. 70% of the world's production of pharmaceuticals are swallowed by Americans. 78% of all opioids are swallowed by Americans, painkillers. So we have to do our part. Just be careful that they realize that you're not telling them what to do with the drugs. You're making a suggestion to their doctor, and they're going to their doctor with the suggestion. Most doctors are aware that the drugs aren't the greatest thing in the world, even though they prescribe them, and they're usually willing to go, okay, let's get you off these things.
Question that relates to that. Cholesterol drugs, we see lots and lots of folks on statins. So what is your position on that?
The statin drugs are useless, and it's just a matter of time. They're already falling into a lot of dispute about them. They really don't save you from a heart attack, so there's really, quite frankly, there's no reason to really take them unless your cholesterol is over 300, and even then you would take them for a short period of time. I give the patient the literature on statins, and then I tell them to go talk to their doctor and show them the literature and try to get them off the statins, because very often if they're taking statins, those statins alone will cause back pain, leg pain, neuropathic pain in the legs, and memory loss. However, I should point out a new study just came out that says that statins, in fact, do not cause memory loss, and yet I found out that study was done by the pharmaceutical companies. So, it's really not good. We all know this. We have a medical profession owned and operated by the pharmaceutical business. Politicians are owned and operated by the pharmaceuticals. That's why I always tell a patient, I wouldn't take any drug unless it's been on the market for at least 10 years. I really wouldn't. And that goes for supplements too, because the supplement business, they're just as nefarious as the pharmaceuticals. I wouldn't start taking some new supplement unless it's been around for a good 10 years. Okay? So we'll move on to the next study, okay?